Okay, we've all been there, right? Sitting in that chair, arm out, waiting for a blood draw. But have you ever actually stopped to think about the tools they're using? Because it turns out the choice of needle is anything but random. Today, we're diving into the two main contenders in a kind of tale of two tools and finding out why one might get picked for you over the other.
So, picture it. You're rolling up your sleeve. The person prepping the gear has a decision to make. And you know what? That choice is all about you. It's not a guess. It's a careful, calculated decision that's based on a ton of science and experience. So let's find out what's really going on behind that choice.
All right, first things first, we've got to meet our two main players in the world of taking blood, also known as phlebotomy. In one corner, we've got the industry standard, the everyday champ, and in the other, a specialized tool made for those trickier situations. Now this is probably what pops into your head when you think blood draw. It's the straight needle. Usually it's connected to either a syringe or, what you see a lot these days, a vacuum tube holder. It's the go-to, and for very good reason. The straight needle's job is pretty clear. It's the most common, it's the most cost-effective, and it's absolutely perfect for your standard, everyday blood draw on an adult with healthy, easy-to-find veins. You could almost think of it as the reliable family sedan of the phlebotomy world. It just gets the job done.
And then there's our other contender. This is the butterfly needle, or if you want to get technical, a winged steel needle. I mean, you can see the difference right away, can't you? Those little plastic wings in that flexible tube, they're not just for looks, they have a super important purpose.
See, those wings are the secret sauce. They give the phlebotomist an incredible amount of control and a really stable grip. And that flexible tube, it means that if you happen to move just a little bit, the needle is way less likely to pop out of the vein. Pretty smart, huh?
And this is exactly where the butterfly needle has its moment to shine. It's the specialist you call in for the tough cases. We're talking kids, the elderly, or really any patient whose veins are just small, a bit delicate, or kind of hard to get to. It is all about precision when you don't have a lot of room for error.
All right, so now that we've met our contenders, let's put them side by side. When does a healthcare pro look at the situation and choose one over the other? Well, it really comes down to a few key trade-offs. This chart pretty much breaks it all down for us. As guidelines from the World Health Organization show, the straight needle is a winner for being efficient and cheap when the draw is straightforward. But its rigidness can be a real downside with fragile veins. The butterfly, on the other hand, gives you all that precision, but it costs more. And that tiny bit of air in the tubing can mean the first sample tube doesn't fill up all the way, which is definitely something the phlebotomist needs to plan for.
So, if we're going to boil it all down, if the vein is like a wide-open highway, clear and easy to hit, the straight needle is your tool. But if that vein is more like a tricky, narrow side street, the butterfly needle brings the finesse you need to get the job done right.
But you know, the needle itself is really only half the story. A successful blood draw depends just as much, if not more, on the skill of the person holding it and the exact procedure they follow. And this quote right here, it just hits the nail on the head. A nervous hand, an unsteady grip, it can cause a miss, and it doesn't matter how great the equipment is. It's a fantastic reminder of the incredible skill that goes into this thing we see as an everyday procedure. At the end of the day, the best tool in the world is totally useless without the right technique. The training, the confidence, and that steady hand of the phlebotomist, those are the most important things for making sure a draw is safe and successful. So beyond skill, a good draw also means getting an accurate result, which is where this comes in. You know those different colored caps on the blood tubes? They're not just for decoration. Each color contains a specific additive for a different test. And if those get mixed, it can completely mess up the sample. That's called additive carryover. So how do they stop that from happening? Well, phlebotomists follow a super strict universal protocol called the order of draw. It's this exact sequence that makes sure any potential carryover from one tube won't mess with the results of the next one. It is a non-negotiable rule that guarantees your lab results are accurate, and it's another reason the needle choice is so important. Remember that little bit of air in a butterfly needle's tube? That has to be accounted for so it doesn't throw off the super precise blood to additive ratio in that first critical tube. So, after looking at the tools, the technique, and the whole procedure, what's the final verdict here? In the battle of butterfly versus straight needle, who's the winner? And the answer is, there is no single best needle. It's that simple. The real winner is always the tool that's right for that specific patient for their unique veins. It's a professional judgment call made every single time to ensure the safest, most effective, and most comfortable draw possible.
So the next time you find yourself in that chair, arm out, maybe take a second to really appreciate the thought process that went into that little piece of equipment they're about to use. Because it's not just a needle. It's the end result of a careful process that combines the right tool, the right skill, and the right procedure, all for you.
Thank you for watching. Like, share, and subscribe.